more information.
In the meantime, Martha, 14 minutes past the hour now on the eve of health care's anniversary. The House votes to get rid of part of that law. The Independent Payment Advisory Board, known as IPAB, IPAB, as in boy. It's designed, they say, to control the cost of Medicare, but critics argue it's misguided and will only lead to rationing of care.
Seniors don't want bureaucrats. They don't want acronyms. They want access to their doctor of their choosing.
Let's talk to a doctor right now. Pennsylvania Congressman Tim Murphy is the co-chair of the Republican Doctors Caucus. Sir, good morning to you back in your home state of Pennsylvania, your hometown of Pittsburgh. Why did you think it was important to get rid of this?
Well, this goes back to the things we were told before the bill passed. We had to pass it in order to find out what's in it. And in these last 2 years, it's been a full-time job of Congress to find out what's in it. And one of the things we've discovered with this Independent Payment Advisory Board is that they will make decisions on what's paid for and how much. Now, when you can't pay for care, that is care denied. Who makes these decisions? Well, another concern we have is of this 15-member panel, they're political appointments. Less than half the panel are allowed to be physicians. Beyond that, it's going to be hospital administrators, economists, other people who are involved with money and financial issues of health care. And if you want to appeal that, if you want to change that, you can't go to your doctor, you can't go to your hospital.
You have to go to this
You
panel.
can't even go to your member of Congress. You have to go, well, it's going to take an act of Congress to change that. Talk about a bureaucracy between you and your doctor making decisions. It's almost an impossible hurdle.
Now, the other side argues that this is the way you control costs. And if you want to keep the cost of Medicare down, you have to have, at some point, there has to be a line of defense against excessive spending. What would you say to them?
Well, what we need to do is improve care. What Medicare has tried before is just controlling the prices for individual procedures, paying less and less for that, and that's where doctors would not want to take on Medicare patients. That system has failed. We do know that if you follow the science of best medical practices and work, for example, with disease management, careful handling of patients when they have certain diagnoses, give doctors leeway for their quality and performance there, you can reduce costs by 20, 40, sometimes as much as 75% for care. What this panel is going to decide is what gets paid for and how much. And that's, I believe, continuing on with what's done now, just this price control and price fixing. And it goes to what this administration has done all along. They don't trust doctors, they don't trust insurance companies, they only trust a bigger government. And this panel will be isolated. They can't be withdrawn from their positions. It requires a law change passed by the House and Senate and signed by the President to overrule some of their decisions. And even when they release the report,
this is not going to go anywhere in the Senate. The President's already threatened a veto. But I think in the larger picture, minus the details of what's in it, is this the Republican strategy to go after health care regardless of what the Supreme Court rules? And that's to try and take it apart piece by piece?
Well, I think by taking it apart piece by piece, we're pointing out what Speaker Pelosi charges with, find out what's in it. The issues with the old 1099 tax issue, the 20 different tax increases in here, the Class Act repeal, the issues involving contraceptive drugs and requiring religious organizations to provide them, this issue with the Payment Advisory Board, are a fraction of what is in this 2,000 pages. As we unpeel this and find out what's in here is a massive bureaucracy between you and your doctor. And we need to point these things out. And quite frankly, we're going to discover more as we analyze this bill.
Yeah, I understand the point you're making there. The President has no public events this on the 2-year anniversary. What do you make of that?
Well, I can understand why. Perhaps there's when 57% of the American public are saying they are against this bill, it's not something to really be proud of. This bill was done in haste, and we are looking over this last couple of years, still discovering things. There still is 150 boards, panels, and commissions, many yet to be appointed. We won't know what's in it yet.
Tim Murphy, thank you. Congressman out of Western PA, thank you, sir, for your time today.
Great to see you, Bill.